All right, we're here today with Kevin, and Kevin is about to start his treatment with Dr. Davis. Now, Kevin, how long have you had the knee pain?
Since April of 17.
All right, and how did it start?
Putting floors in my house, and I just started having pain after that.
And it just continually got worse?
It got worse over the summer and up till now.
Okay. Have you seen any other doctors for this?
Just a family practitioner.
And what did your family doctor do for you?
He drew some fluid out of my knee and put some steroids in there to get rid of inflammation.
But you still have pain?
Yes.
Okay. How is this negatively impacting your life? What's this holding you back from doing every day?
Playing golf, riding a motorcycle, and just general walking and...
Okay. Yeah. Pain is just too painful.
Yeah.
What is your pain level today in that knee from 0 to 10?
7 or 8.
7 or 8, okay. I'm going to have you do a couple different exercises for me. If you could stand up for me, Kevin. Any discomfort when you do that?
Yes.
And where is the discomfort?
Inside of my knee.
And kind of on the inside there?
Yes.
Okay. All right, I'm going to have you do a squat for me.
Okay.
Yep, I'm ready, Kevin. Okay. I could see on your face, yeah, that it was difficult. Okay, the next thing I'm going to have you do is I'm going to have you go up and down the stairs, holding on to the railing there, yep, and go up and down the stairs. Okay, Kevin. Now, out of all of those activities you just did, what was the most difficult?
The squat.
The squat was difficult. And I also noticed when you were going up the stairs, you had to put, you could only do one step at a time.
Yes.
So it's more difficult going up the stairs than down also.
Yes.
All right, let's get you started with Dr. Davis. All right, we're here with Kevin. Kevin's finished his first treatment with Dr. Davis, so let's see what you got. Can you stand up for me, Kevin? How was that?
That felt pretty good.
All right, let's do the squat. I know that was giving you the most difficult last time. Holy cow.
Yeah.
How
really.
was that?
That's pretty cool.
All right, let's go up and down the stairs, okay?
Okay.
Wow, you only use 1 foot per step going up and down.
I know, and there was hardly any pain.
All right, because I know your pain level was a 7 when you started. What do you think it is now?
3 maybe.
That's great.
I know, feels pretty good.
So have you seen a significant improvement?
Very much. Yes.
All right, we haven't even started therapies yet. Wait for therapy.